Hello everyone, I'm Dr. Bang, the hair wizard, here to protect your hair. It's a pleasure to meet you all. Many people are familiar with hair transplants, but don't really know what they entail. It's essentially moving hair, like relocating it from one place to another. It was simply a matter of taking what was there and transplanting it. It started very simply as a process of extracting a long strip of something, sorting it out, and then transplanting it. But then, some issues started to come up with the incisional method. What kind of issues arose? Patients expressed experiencing much more pain than anticipated, and the resulting scar tissue was the most significant problem. This led doctors to begin contemplating solutions. The surgery's outcome itself was positive, however. The resulting scar as an after effect presented a significant issue. Patients would look at the results and want them, but they were afraid and hesitant to go through with it because of the scar. I felt the same way. Even as I performed the procedure, I'd get hesitant when the topic of scars came up. Patients would ask, "Doctor, will there be no scar?" And I'd have to say, well, a scar will form, and it varies from patient to patient. You might also experience pain or sensory changes. I had to explain that it was an unavoidable trade-off for the results. But as I got more involved in academic conferences, I learned about a new technique called the non-incisional method. What it is that instead of removing it as a whole piece, a new method emerged where we extract them one by one. Initially, I couldn't quite grasp the full understanding of it. I went to a conference, and seeing an overseas doctor perform the surgery, the results looked incredibly clean and aesthetically pleasing. So, with the incisional method, it's like lifting an entire seedling tray. You take a whole piece, process it, and then implant it. The non-incisional method involves extracting and moving each one individually. You can think of it that simply. When comparing incisional and non-incisional methods, we look at the remaining wound here, on the back of the head, which is called the donor area. A major comparison point is the extent of scarring or after effects left at the back. With the incisional method, a whole strip is removed. For individuals with excellent healing capabilities, who rarely scar and have a higher pain tolerance, there's often minimal discomfort and hardly any scarring. Moreover, even if a scar does appear, it doesn't bother them. Why? Because the outcome in this area is so remarkably good. Even if the front area improves, some individuals who dislike the scar or a strange feeling at the back will continually raise it as an issue, and for that, there's no solution. But with the non-incisional method, since we're harvesting one by one from a wide area, there's much less worry about scars and pain. Of course, you can still get scars and feel pain, but the chances are much lower, and even if it happens, it's far less severe compared to the incisional method. When comparing incisional and non-incisional methods, people often mention result differences, such as the engraftment rate, but I've recently found there's hardly any difference. The results can be quite similar. I'll explain this again when we discuss the transplantation method. But during harvesting, if you're not too sensitive to pain and are tolerant about scars, then you can consider the incisional method. But if you think you'll be sensitive to pain or scars and you want to avoid any risks or uncertainties for the future, then I would say the non-incisional method is a better option. When explaining the non-incisional method, patients already know about the pain and scarring. But the reason I keep recommending the non-incisional method, why I believe it's superior, is this. Just consider it. You've harvested a patch of scalp. We typically extract it from the prime spot, the area boasting the greatest density. In short, I want to transplant a lot for you, so I take plenty from the best donor area. This specific part of the back of the head is ideal. If it's lower, higher, or to the side, the scar will show, and that could cause problems. So, the best scar-free spot is here, and that's where we take the strip from. The shape and amount we take varies, but the problem is it contains a lot of thick hair. So, let's think about that. Is the main goal of a hair transplant simply to have as many hairs survive as possible, or is it to ensure the final result looks natural and beautiful? That's the most crucial consideration. In the past, the engraftment rate was key. How many transplanted hairs successfully survived after planting? If we planted 10 and 9 grew, the doctor would declare a successful outcome. But if those 9 hairs aren't beautiful or natural, the patient won't be satisfied. From the doctor's side, as long as the transplanted hairs survive and grow well, it's a success. But for the patient, it might not be okay at all. That was one of my concerns. They say non-incisional harvesting is done one by one. So if you need thin hairs, you can just harvest more thin ones. If you need thick ones, you harvest more thick ones. You just have to be honest about it. You can't just harvest thin hairs and then pretend they're thick when you implant them where thick ones are needed. So, with the non-incisional method, if we just stick to the proper principles, the likelihood of boosting quality becomes higher. Therefore, for those with thin hair, or those needing to reinforce their hairline, or even for transplanting hair with different textures like eyebrows or beards, the non-incisional method is naturally superior. Since it allows for selective harvesting of specific strands, the quality is inevitably higher. That's why we can confidently say the non-incisional method is the better choice. With less pain, minimal scarring, and even the potential for much improved results. Of course, if the selective harvesting is done poorly, the results could be worse. The operation time might become longer, and there could be unnecessary harvesting, leading to complicated situations. However, if these aspects are managed properly, the outcome is consistently superior. From my perspective, I perform both the incisional method and the non-incisional method. The incisional method is certainly a little shorter and faster to complete, but it's the after effects that are the problem. The pain and the scar. I dislike them. It's frightening. Why? You have to justify, explain to patients, and they must self-care. I dislike instability. Non-incisional operations take longer due to individual harvesting, but yield higher aesthetic completeness. With less pain and scarring, that issue is simply eliminated. Then, all that's left is to focus on the outcome. So, I just need to perform my duties well. I harvest correctly and implant correctly. Then I can confidently tell the patient, let's wait and see, the result will be excellent. I explain it to them this way. From my perspective at that time, I truly gave my best effort. So if you, the patient, just provide a little cooperation and we diligently manage it together, the outcome will undoubtedly be optimal. So I tend to recommend the non-incisional method because I'm more comfortable with the results. Today, we briefly went over the types of hair transplant, harvesting methods, and so on. I hope to see you again. Thank you.